every day is going to be different. There's always going to be a new case, a new patient, or a new scenario that we really get to be creative and put our own styles on how we interact with folks.
Hi, I'm Lucy Gleistein, and I'm a behavioral health consultant at Mazzoni Center.
I'm CJ Zaretsky, and I'm also a behavioral health consultant.
Hi, my name is Shaq, and I'm also a behavioral health consultant. We are mental health professionals that work with primary care inside of our health center just to make sure that everyone has access to the care they're looking for. We try to provide a more holistic approach and a more integrated approach. So we're working side by side with your medical team and just giving you a little touch of behavioral health whenever you're coming into our health center.
Yeah, and primary care is really inundated with mental health needs, and so we get to be kind of a part of the process of identifying mental health concerns as they come up and treating them and connecting patients to care.
Yeah, and I think one of the kind of models of BHC is like recognizing the barriers to accessing mental health care outside of maybe their primary care. And there can be wait lists and financial barriers, so we try to kind of make it as accessible as possible within a context of a health center that patients are usually already comfortable with and trust and feeling safe, that feels safe to them.
So we often get warm handoffs or calls from providers to perform gender-affirming surgery letters to help folks get access to gender reassignment surgery or gender-affirming surgeries. We do things such as being a touch point for a person who may come in and present to their doctor with some symptoms of depression or anxiety. We help them with some short-term interventions to help reduce the symptomology associated with those.
Yeah, and part of that is because a lot of the patients at Mazzoni feel so comfortable with their primary care providers. They'll share just like really intimate details of what's happening. So if someone just experienced a huge loss or went through something really traumatic, they'll tell their medical provider, who will then kind of loop us in. And sometimes it's not always like bad stuff. Sometimes it can be very joyful. So like if someone is starting their like medical transition for the first time but are feeling a little nervous or have some things they want to talk through, we get kind of like pulled in for counseling around that as well.
Yeah, and a lot of times it can also involve kind of talking through like family dynamics, relationships, and sometimes it'll be kind of that one-time meeting, like Shaq was saying, like a warm handoff in the context of the medical visit, and then a lot of times we'll schedule follow-ups. Sometimes it's once, twice, multiple times, and we try to just also be around and available whenever that patient returns to the office to just check in. I think a real benefit of us all kind of starting in this new role is getting to kind of build it together and figure out what works, what doesn't, and just really like collaborate to, figure out kind of what's best for patients, providers, and then the three of us too.
And I feel like we're a really solid team. Like we get to just like work really closely together every day instead of just like being in separate offices. We're kind of all together, and all of us are seeing really different things. Like even though we all have the same job description, the day-to-day is just very different for everyone. And so kind of get to compare notes and like troubleshoot things and talk through like any kind of questions that come up. And it feels like a really kind of like great supportive space.
Absolutely. And then the three of us all come from different backgrounds, personal lived experiences and professional experiences. So getting together and really highlighting each other's strong suits has been very beneficial for us.
I think for me, as a trans person, like kind of knowing what it feels like to sometimes like be in a medical setting that doesn't feel affirming or doesn't feel safe, and just also like the anxiety that can come up with that, and wanting to be a part of, a medical setting where it's really like actively, that's the goal of like making sure that people feel as affirmed as possible. And that starts at like the minute they walk in the door with their name and their pronouns being used. And yes, and just being able to kind of integrate like my kind of background and training in like mental health and social work, and then kind of integrating that into the primary care models for me, what brought me here.
Absolutely. And then for myself, again, as a queer person of color, I recognize the need for more clinicians, therapists, providers that also identify with that identity. So I wanted to be sure that I was working with an organization that emphasized the need for that And Mazzoni Center definitely does that for us. For me, it's always doing these surgery letters with folks. As my colleagues have said before, in other places, this can be a very stigmatizing or pathologizing process. It could be very costly, and Mazzoni Center does a really good job of making it very accessible for all of their patients. And seeing the look of relief on their face when I tell them, we did everything that we were supposed to do. You have your letter. We're on. We can move you on to the next step of the surgery process, and just seeing how folks light up and really feel seen and supported in that moment is really what keeps me going.
I think just moments like that, I feel really proud that the patients that we see really love coming here, and that we get to be a part of that process.